Technical Veterinary Learning TVL channel, founded and produced by Professor Ahmed Mamdouh El-Sharif, Professor of Epidemiology and Infectious Diseases of Animals, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Bani Suef University. Viral diseases of pet animals. Infectious canine hepatitis disease, or ICH, has another 3 synonyms: canine adenovirus infection, hepatitis contagious canis, and fox encephalitis. Infectious canine hepatitis disease characterized by fever of diphasic shape, highly contagious disease. All domestic and wild canine can contract the infection. Infectious canine hepatitis disease characterized by severe hepatitis, tonsillitis, hemorrhage and multifocal vasculitis, edema of gallbladder. Pathogenic risk factor. Virus classification of infectious canine hepatitis virus. It is belonging to virus Realam Viridina viria, kingdom Bamophilidiviri, phylum Preplasmoviricta, class Tactile Virictes, order Roaviralis, family Adenoviridae, genus Mastidinovirus, species Canine Mastidinovirus A with synonyms Canine Adenovirus A, Canine Adenovirus, Canine Adenovirus 1, Canine Adenovirus 2. Infectious canine hepatitis virus belonging to family Adenoviridae, genus Mastidinovirus, with 3 types of viruses: Canine Adenovirus 1, Canine Adenovirus 2, and Canine Adenovirus 26/61. This slide contains the shape of the virus under electron microscope with 4 dimensions. Canine adenovirus, it is non-enveloped double-stranded DNA virus, survive well in frozen or dried environment, inactivated by boiling up to 60 degrees centigrade for 3 to 5 minutes. Other resistance to physical and chemical actions: it inactivated at low pH, resistant to dry heat up to 90 degrees centigrade, may be inactivated with steam cleaning, inactivated by under 2,500 part per million of sodium hypochlorite, beta propylocolone, exciting agent, hydroxylene, 2% of sodium hydroxide, and formalin. This picture showing a cut surface of adenovirus under electron microscope. This figure showing a cut surface of the pox virus under electron microscope after coloration. Epidemiological patterns of infectious canine hepatitis disease. Mortality rate of this disease ranges from 10 to 13%, and it is typically highest in very young dogs. Morbidity rate reaches to 100% in endemic areas. Mortality rate of this disease ranges from 10 to 13%, and it is typically highest in very young dogs. Host risk factors. All members of family Canidae, that includes dogs, foxes, jackals, hyena, and wolves, and etc. are contracted the infection. Geographical distribution of the disease. It is firstly described at 1937 in Europe, but then recorded in all Africa, Asia, Europe, and United States, as well as Australia. Sources of infection for infectious canine hepatitis: feces, urine, blood, saliva, and nasal discharges. Infectious canine hepatitis mode of infection. Number 1. Contact with urine, fecal contaminants from infected animals. Number 2. The virus is acquired as nasal-oral or conjunctival infection. Number 3. Direct contacts between infected and sound animals. Pathogenesis. Incubation period of infectious canine hepatitis disease is about 6 to 9 days. This illustration demonstrates the pathogenesis of adenoviruses, which reach to tonsils, as we said before, mode of infection through different excretion and secretions of infected animal, then reach to tonsils where they replicate, and then reach to the neck lymph nodes for another replication. Then it reach to the lymph vessels, which carry them to the blood stream, leading to viremia, where the animal here suffering from fever of diphasic nature. Through the blood, they distributed all over the body organs to the liver, where they replicate and cause acute hepatic necrosis, and then hepatitis, and ended by death. When reached to the kidney, it causes acute damage of glomerular and causing glomerular nephritis. Then reach to the renal glomeruli, where the virus shedded for a long time after disappearance from blood circulation. If it reached to the eyes, it causes keratoconjunctivitis, where the animals showing uveitis. It also goes to endothelia of vessel organ, causing cytolysis and vascular damage. This is another illustration for the pathogenesis of adenovirus or canine adenovirus 1, 2, and 21/62. When the virus enters through nose or mouth, it reaches to the tonsils, then to the cervical lymph nodes, where the virus is replicating here. Through the thoracic duct, it reaches to the blood, causing viremia with diphasic nature of fever. Then, when reached to the eye, it causes uvea, where anterior chamber corneal endometrium, causing immune complexes, severe uveitis, and corneal edema. The sequelae of the disease is glaucoma, keratoconus, hydrothalamus, pulp, and ocular recovery. Endothelium heals here if it treated rightly. If it reaches to the liver, when Kupffer cells or hepatocytes, by means according to the level of the infection. If Kupffer cells or hepatocytes become in low titer, it causes centrolobular necrosis of the liver, which cause either acute death or acute hepatitis. If it reaches to the acute hepatitis and is treated by supportive treatment in good manner, maybe clinical recovery begin. In high titer of copper cells presence is called chronic hepatitis and chronic hepatic fibrosis, where this means persistent infection until the death of the animal. High titer also appear in mild inapparent disease, where the disease here become carrier. When the virus reaches the kidney, it goes to glomerular endothelium, where immune complex occur and causing glomerulonephritis, reach to the focal interstitial nephritis, where the urine here will be loaded by the virus. If it reaches to the other endothelium system that present in the brain, lungs, lymph nodes, and etc., it will be excreted with the feces, where organ failure will occur in these later organs, leads to death, or the virus will be cleared from tissue and clinical recovery occur. Clinical signs of infectious canine hepatitis disease. There are three forms of clinical signs due to infectious canine hepatitis. Number one is the per-acute form, where it affects puppies with ages less than 6 months. Infected puppies are found dead without previous symptoms or found dead after signs of illness resembling to poisoning for at least 3 to 4 days. The second form is the acute form, or the typical form of the disease, where animals here suffering from diphasic nature of fever, with depression, loss of appetite, and intense thirst. Also vomition reported in these animals. Another symptoms of acute form or the typical form of infectious canine hepatitis disease is bloody diarrhea, jaundice in case of occurrence of hepatitis, pale mucous membrane in case of bleeding. Hepatomegaly is also reported in this form. The third form is subacute or mild form, where the animals noted after vaccination by 10 to 15 days to suffer from the following pictures. Also, we will find corneal opacity, blue eyes, due to edema of anterior uveitis. The cloudiness of the eye starts at the lumbus and proceeds rapidly throughout the enterocornea, leads to glaucoma. Animals suffering from subacute form or the mild one, also showing uni or bilateral involvement of eyes with conjunctivitis, where signs of pain, blepharospasm, photophobia with watery discharge noted. Signs of ocular involvement may be proceeding for weeks or months. If secondary bacterial infection occur, there will be purulent discharge of the eye will be noted. This picture showing a young adult dog with corneal edema and unilateral blue eye glaucoma due to infection with canine adenovirus 1. A picture of an adult dog with corneal edema and bilateral blue eyes, glaucoma due to canine adenovirus 1 infection. A picture of local dog breed showing corneal edema and bilateral glaucoma due to canine adenovirus 1 infection. Another picture of bilateral glaucoma due to canine adenovirus infection. A picture of adult dog with corneal edema and bilateral glaucoma due to canine adenovirus infection. A magnified picture of an eye of old adult dog with corneal edema and glaucoma with purulent discharges due to infection with canine adenovirus and secondary bacterial infection. An adult dog with icterus at oral mucosa due to hepatitis that come from infection of canine adenovirus. An adult dog with icterus at oral mucosa due to infection with canine adenovirus 1. An adult dog with optic icterus due to infection with canine adenovirus. A magnified picture of an adult dog eye with optic icterus. It is a picture of sonar examination to an infected dog where gallbladder of this dog showing marked thickening of the gallbladder wall due to edema. It is thought to be due to pathognomonic lesions of canine infectious hepatitis. Post-mortem lesions. Dead puppies from hepatic affection shows no evidence of emaciation, subcutaneous edema, and fluid present in 50% of cases in the peritoneal cavity. This fluid ranged between clear to bloody tinged, which coagulate when exposed to the atmosphere. Number 2, fibrinous exudate usually found among intestinal loops. Number 3, hydrothorax was found occasionally in some cases. Number 4, marked edema of gallbladder. Number 5, edematous appearance of lung tissue. And number 6, intestinal canal has normal appearance with soft fecal matter mixed with sometimes with blood. Infectious canine hepatitis showing hepatic necrosis in the liver of a dog, where the liver from this dog can be slightly enlarged and friable with a patchy yellow discoloration. Sometimes fibrin is evident on the capsular surface. There is a petechiae on the serosal surface of the intestine caused by vascular damage. Picture of a liver of a dog infected with canine hepatitis showing petechial hemorrhages as well as fibrin deposition at the capsule. Signs of hepatic necrosis, where the liver is turgid and friable, causing it to rupture easily during post-mortal examination. Gallbladder of a dog infected with infectious canine hepatitis showing gross lesions with marked thickening of the gallbladder due to edema. This is a pathognomonic lesion of canine infectious hepatitis. Intestine and mesentery of a dog infected with infectious canine hepatitis display intestinal serosal hemorrhages with extensive and suffusive within the mesentery and mesenteric root of the dog, with hemorrhagic diathesis is common sequelae of this infection due to endothelial damage. A lung of an adult dog infected with infectious canine hepatitis shows multiple gray and white areas of consolidations due to secondary bacterial infection with non-specific signs of pneumonia. A brain of a deceased dog shows bilateral dispersed small hemorrhages in the gray and white matter within the basal nuclei of the cerebellum grossly. Microvascular bleeding in the brain is the rare development in dogs but a common finding in wild species, explaining the more pronounced neurological signs in foxes. In these animals, infectious canine hepatitis is called fox encephalitis. Histopathological findings. Pathological examinations of dogs infected with infectious canine hepatitis showing nuclear acidophilic inclusion bodies present in the endothelial cells of spleen, lymph nodes, vascular system of the brain, liver sinusoids, and endothelial cells of blood vessels. Histopathological section in a brain of diseased dog where bilateral dispersed small hemorrhages in the gray and white matter within the basal nuclei of the cerebellum. Microvascular bleeding in the brain is rare development in domesticated dogs, but a common finding in wild species, explaining the more pronounced of neurological signs of infectious canine hepatitis in foxes. In these animals, infectious canine hepatitis is called fox encephalitis. Infection of alveolar and endothelial cells of lung tissue with canine adenovirus produces characteristic basophilic intranuclear inclusion surrounded by a clear zone that separates them from the marginated chromatin. Black arrow here shows the inclusion bodies. Infection of hepatocytes and the endothelial cells with canine adenovirus produces characteristic basophilic intranuclear inclusion bodies surrounded by a clear zone that separate them from the marginated chromatin. Black arrows denoted to the inclusion body in this figure. Infection of hepatocytes and endothelial cells with canine adenovirus 1 produces characteristic basophilic intranuclear inclusions surrounded by a clear zone that separates them from the marginated chromatin. Black arrows here denoted to the inclusion bodies. Laboratory diagnosis. For accurate laboratory diagnosis, samples should be collected correctly. Samples from live canine are swabs from oropharynx, swabs from tonsillar crypts, fecal swab, blood plasma, urine, and blood serum. Samples from dead canine are kidneys, brain, lung, spleen, and heart. Main laboratory tests used for identification of animals infected with infectious canine hepatitis are virus isolation at early stages of the infection, number 2 complement fixation test, number 3 ELISA, number 4 virus neutralization test, number 5 PCR and sequencing of the viruses, number 6 marked leukopenia in the blood content, number 7 experimental lab animal inoculation of ferrets, and number 8 histopathological examinations. Here, the shape of cytopathic effect of canine adenovirus on the tissue culture. PCR of canine virus hepatitis 2 or canine adenovirus 2 showed positive results at 500 base pair. Sequencing of canine adenovirus shown here in the phylogenetic tree, where mastodinovirus as a genus and the other viruses of adeno from 1 up to 62. Differential diagnosis. Infectious canine hepatitis have to be differentiated from canine distemper, toxoplasmosis, and leptospirosis. Treatment. Treatment of infectious canine hepatitis is non-specific and supportive. Includes the following. Number 1. Injection of antibiotics to compete with secondary bacterial invasions such as streptobinacid, flumox, Duracif, Tutacif, Hyconcil, and etc. Number 2. Fresh whole blood may be useful to counteract the effect of disseminated intravascular hemorrhages. Number 3. Fluids therapy in severe cases. Number 4. Vitamin K injection to reduce the bleeding time, and hypertonic glucose injection to counteract the hypoglycemia occurs due to neurological signs. Number 6. Good nursing by offering good food, cleaning and warm water and fresh water. Prevention and control. Prevention and control of infectious canine hepatitis includes the following steps. Number 1. Quarantine animals for at least 30 days when they are introduced newly to a captive facility to prevent the introduction of the viruses. And rodent control to prevent the spread of the viruses by them, which include destruction of rodent nests by usage of rodenticide. It is advised to disinfect and clean equipment after handling mink suspected to have adenovirus. Steam cleaning and spraying with 2% sodium hydroxide should be used to properly clean the pens. Number 4. Vaccination against virus is recommended for some captive wildlife. In wild canidae, live attenuated vaccines are given every 2 to 3 weeks starting at 6 to 8 weeks of age until 16 to 20 weeks old. Modified live vaccine. This vaccine has been used in gray wolves, red wolves, and adult maned wolves. There is concern that this type of vaccine can cause death in juvenile animals. Modified live vaccine is not recommended for use in maned wolf puppies until titers has been established after using a killed vaccine. Inactivated and attenuated canine virus 1 and canine virus 2, they are administered with canine distemper vaccine beginning from 8 to 10 weeks of age and booster dose after 4 weeks. Multi-vaccine or pentavaccine that includes Leptospira canicola, Leptospira ecterohemorrhagica, canine distemper virus, infectious canine hepatitis, given to dogs at 3 months of age and repeated annually. Hyperimmune serum may be used to raise the non-specific immunity of animals. Times specification of dogs vaccination. Prevention and control. Vaccination guideline for your dog. At 6 to 8 weeks, vaccination with canine distemper, canine hepatitis, and parvo for the first injection. At 9 to 12 weeks, the vaccination for second dose for canine distemper, canine hepatitis and parvo, and first injection for corona, first injection for portodella at 3 to 4 months or 12 to 16 weeks, the third injection of canine distemper, of canine hepatitis and parvo, second injection of corona, second injection of portodella, and the rabies. Then annually repeat all the latter. Here the image of a dog with canine distemper which reach to the brain, rabies reach to the brain, canine tracheobronchitis reach to the area of lung and trachea, and canine coronavirus in the area of intestine, canine parvovirus in the area of intestine, infectious canine hepatitis in the area of intestine and liver. We're keeping you on the right track, so please subscribe the channel to reach to the most newest knowledge about the epidemiology and different infectious diseases of different species of animals. See you later.